My name is Matt Carlson, and I'll be presenting an instructional video that basically outlines the steps of setting up your facial nerve monitor and prepping the patient and placing sterile drapes. Preferences are different among institutions, but generally at most teaching institutions, facial nerve monitoring is considered a routine practice for almost any case of middle ear surgery, obviously excluding PE tube placement, etc. With regard to positioning for chronic ear surgery, the patient will be positioned supine with their head turned away from the operator. People with very flexible necks, sometimes you'll have to place a towel or something else under the contralateral cheeks so they don't turn too far away. In general, it's best to have the neck slightly extended if there's no contraindication in doing so. That allows better access to the ear. For younger children, sometimes that does involve placing a small shoulder roll. For adults, it's less commonly required. Per routine in otologic surgery, we typically do 2 lead facial nerve monitoring. You'll also need to place your return electrode or your ground electrode and your stimulating electrode, and you can place those anywhere off field. They can be in the shoulder, in the sternum, or another place. It's just important that those 2 needles don't directly contact each other. It's important when you place these leads to not place them just subcutaneously. These are EMG leads, so they need to go through the muscle. So on somebody with thicker subcutaneous tissue, you might have to go at a more direct angle to make sure they're going through. After we place the leads, we typically add a little redundancy to the loop before we apply sticky tape, so that if it's pulled underneath the drape, you won't dislodge your electrodes. After that, you'll take your lead wires and you'll put them into your lead box, and you'll want to make sure that you're matching them up with the right regions. You'll then go to your monitoring box. Most centers in the United States use an automatic or automated nerve detection through the NIMS monitor, but there are a lot of different ways to do that, including employment of a neuromonitoring team, which we'll often do for vestibular schwannomas and skull-base surgery. The NIMS box has an on-off switch on the back, and then you can designate your preferences for different types of procedures. For ear surgery, we'll typically set a threshold for an event at 40. After the electrodes are in place and you've connected everything to the NIMS monitor, you'll want to check to make sure everything's connected by gently tapping on the face over the electrodes. Typically in ear surgery, you don't have to shave much postauricular hair. You'll be drawing your incision usually about 0.5 centimeters behind the sulcus, so if you have enough space there, it's okay generally to not shave hair. Even for cases of cochlear implantation, generally you can brush the hair away with your Betadine prep, and there have been several studies that demonstrate that having hair in the field, provided it's prep, doesn't introduce an increased risk of infection, and most patients appreciate it as well. We typically use Betadine prep for ear surgery. Betadine is thought to be very safe in the middle ear, if any of it gets into the middle ear through a perforation, etc. Chlorhexidine and alcohol are thought to be toxic in the middle ear space and are generally not used for chronic ear surgery. You'll want to start in the middle of your field and work to the outside with your prepping. Particularly for the ear, you want to clean the postauricular sulcus. Sometimes that collects debris and dirt in some patients. You'll want to prep your field wide enough so that if your drapes move or migrate a little bit, you'll still have a buffer for your sterile field. We then place towels over the surgical field, place the towels around our area of prep. I tend to staple the drapes in place. It keeps them from moving around during the case, and then afterwards I'll place the drape over top that has tape to hold it in place as well.